Review these structures and the border molding movements of the mandible. Review these structures and the border molding movements of the mandible. The mouth should ideally be in a state of health. Existing dentures have been left out for 24 hours prior to the impression, at a minimum. The existing denture may be realigned with a soft tissue conditioner to aid in healing. The patient should have completed all or most surgery. The default time for the completion of post-surgical healing is a minimum of 6 weeks. This time may be variable depending on any number of circumstances. On rare occasions, very minor procedures may be done after denture delivery. You are ready to make an impression. When you are satisfied that your impression tray is ready, your patient should be well versed in movements required to functionally mold the impression, and has met other requirements, as noted in the slide. Because the propensity for gagging is enhanced with the maxillary impression, it is advisable to begin with a lower impression. There are several ways to acquire a defective impression, such as misalignment of the tray, show-through areas of too much seating, excessive thickness from inadequate seating, large voids, movement of the tray, inappropriate amount of material. There are, conservatively, several dozen materials that may be used for complete denture impressions. We will use rubber base. The chief advantage of rubber base is that it will be stable long enough to get a good pour without rushing. It can be handled without fear of gross distortion. Chief among its advantages are that despite its obnoxious smell and appearance, it is very innocuous, unlikely to get locked into an undercut or tear, and it is inexpensive. This is very important, especially when repeats are to be anticipated. There are several disadvantages to using rubber base. As with most things, practice will make the experience less obnoxious. Be sure to protect the patient's clothing. Rubber base will not come out. Warn the patient that it is smelly. Take extra care to avoid creating a mess. It should be poured within 1 hour. The objectives of a good impression are listed here. Getting a good occlusion, a good impression, and making the patient look good are the keys to a successful outcome. When making the impression, movements of the oral tissues mirror that of the border molding. The tray should be held motionless until setting. Remove wax spacer, if any, from the tray. Place Vaseline on the model. Paint tray adhesive on the tray. Allow 10 minutes to dry. Mix the material. It is best to coat the mixing spatula with the brown material first. Load the tray, making sure material overlaps the tray border. Seat the tray, allow to set. Boxing the impression. To preserve the entire impression, registration with a land area, which will preserve the border molding and resist compression fracture. Seal the red utility wax to the impression with a hot wax spatula. The impression is assumed to have been disinfected prior to bringing it to the lab. Wax added should be sealed. Boxing wax is used to form sides of the future stone cast. The tongue space should be filled with boxing wax, as shown in the figure. Extra wax is placed behind the retromolar pad area. The wax is sealed around the impression. Use the vacuum spat to mix stone. Clean up before setting. Place the impression cast in a bowl of warm water. Then pry the impression out with a loud knife. Hopefully your cast will have no voids. Small blebs will exist as a result of voids in the impression. These may be scraped off. Small less than 2 mm defects may be repaired with stone. Larger defects will require a new impression. The base of the cast is flat, relative to the occlusal plane of the arch. The base is 15 to 16 mm thick. The land area and borders are preserved with a land area 3 to 4 mm thick. The cast is thick enough to resist fracture, but will not break when processed. The finished casts should look like this. Use the arbor band to prepare index grooves. Lubricate only the grooves when mounting. The cast may be removed, and returned to the mounting when necessary. Identify the anatomic structures.